The interesting case that I chose, we weren't actually able to go through with this case, but I just kind of wanted to talk about it. So, there is a 6-month-old llama who has a severe 4 out of 6 heart murmur on the right side. And Dr. Copeland had originally saw this animal and saw that he was on the schedule to be castrated the other day. And it was the day I was with Dr. Damani, so I believe Wednesday. So Tuesday, she let me know about the heart murmur, and because a couple people were going to be off work, that me and Dr. Damani were the only ones going out, so I was going to have to run the anesthesia on this guy. So I was pretty nervous about it, especially how bad they were making the heart murmur sound. So we had everything at the ready to take out to this man's place to castrate this llama. We had... and I heard a couple of different things. I did ask all of the technicians kind of what they thought, and a couple of the doctors, to kind of get an idea of if something bad were to happen or what they would induce with and whatever. So quite a few people said to just use BKX, not necessarily do a pre-med of any sort, but just do the BKX, which is 1 mil per 100 pounds. And since this is a 6-month llama, he's not very big, so they said usually they would give a quarter of that dose, so they were telling me to start with 0.4 and then bump with 0.2 if needed at all. But then someone said that they could also pre-med with atropine, which doesn't really have anything to do with the heart murmur, but with ruminants, they salivate a lot and then also try to regurge. So the atropine was to, as a pre-med, is just in hopes of slowing down that salivation so they don't have a tendency to regurge when they are knocked out. So yeah, they said to start with a 0.4 dose to get them to cush, and then bump with a 0.2 to get them into lateral if they aren't already in lateral from that 0.4. And we had epinephrine at the ready just in case we needed it. But when we got out there, Dr. Damani wanted to listen to the animal first, and he did, and then I wanted to listen to it as well, and it was the worst heart murmur I've ever heard. It sounded like someone was doing laundry in this poor kiddo's heart. It was really bad. But then Dr. Damani, once he listened to it and evaluated it, once the gentleman brought him in from the outside of the stall to the inside, he was already breathing hard and cushed down. And so Dr. Damani's like, maybe we won't do this today, and we ended up not. He said that he would rather him bring that guy into the hospital and do him down in the surgery suite, so we have oxygen at the ready. He's like, he was already stressed out and out of breath from the 30 to 45 seconds it took the man to get him from outside the stall to inside the stall, and he cushed down exhausted. And he's like, I would hate to have to lose a patient during a 5-minute elective procedure. So even though we were at the ready, we had all the precautionary things. We had fluids ready to go, epi, all that stuff. Dr. Damani just would have felt a lot better having him come into the clinic. So if something were to happen, we have oxygen there, we have ISO, we have monitors to better monitor him and just take more precaution with it. At that point, though, Dr. Damani did ask the owner to really think about this llama's life. Does he really need him castrated? The only thing the owner was thinking is because he does have other llamas, he doesn't want him to have all that testosterone running through and him bothering with all the other llamas, especially the females. So that was his thing, but he was also on the fence about it for the fact that he's 6 months old with that severe of a heart murmur. And so he's like, well, he might not live that long anyway. So the owner was going to call into the hospital and reschedule the castration because it seemed like he still wanted to go through with it. So if he does, I will try to keep you posted about it. I did ask to be put on the schedule for whatever day that man rescheduled the castration for. So even though we didn't go through with the procedure, I just wanted to talk about what we would do for a ruminant in an emergency situation or in a heart murmur situation and everything like that. So like I said, we had fluids, we had epi, we had all of the emergency doses already calculated out for this kiddo, and we were ready to go if need be. but we did not go through with it. But it was still pretty interesting to hear about different ways to induce a patient like that and what to do if they were to start crashing. And so that's my interesting case of my last week.
Hi, Dr. Noreen! I was waiting for the very end of externship to tell you some super exciting news, but surprise! I am an official employee at Comstock Equine Hospital now. My official first day is Monday, and I wanted to thank you for everything that you've done this semester for me and for everyone. You have definitely made this program worthwhile, and I appreciate you so much and thank you greatly for it. Thanks so much. I can't wait to see you at graduation.